And the bigger problem of healthcare is not care itself. It is everything surrounding the care. It is the way clinicians, instead of focusing on the patient, are managing system. Healthcare exists to care for people, and clinicians get into healthcare to care for people, not to manage system. So when AI first hit healthcare, I got so excited because I saw the possibility. If implemented the right way, AI can give something clinicians have been increasingly losing: their attention, their presence with the patient, their ability to think, to really come up with something personal or designed for the patient in front of them, the ability for the patient to feel heard, because the clinician will not be busy managing the system. So the value of AI isn't the number of tasks it can perform. It is the ability to give clinician that presence, return to the clinician the presence they need. If technology gives clinician more time to listen, to think, and to connect, it has created great value. The future of healthcare won't be defined by how much AI we use, but by how much humanity it helps us to preserve. That's why I believe the goal is not more AI. The goal is better care.
Welcome to Inside Home Health. I'm Arvind Sarin, CEO of Copper Digital. My guest today has done something most people in healthcare never do. She's worked across almost the entire map, from trauma to critical care, urgent care, informatics, school health, and of course, our beloved home health. 13 plus years as a nurse practitioner, seeing the same system from a dozen different angles. And that cross-setting view led her to a conclusion. And I completely agree with that. The problem in healthcare usually isn't a lack of technology. It's the way the work is designed. Genevieve, welcome. I'm excited for this one. Let's get started. If you don't mind, give me the short version of your path, because you've seen more corners of this system than almost anyone that I've talked to.
Hello, Arvind. Thank you for having me. My name is Genevieve Fom. I am a family nurse practitioner and a clinician-led AI implementation strategist. I help healthcare leaders determine where AI belongs and where it doesn't, and how to implement it in the way that support clinicians rather than adding more burden. The problem is, like, many leaders have been told AI can solve everything, but they don't know exactly what problem AI is supposed to be solving, or if AI is to be considered at all. So that's when I come in. I help them assess their workflow first, have clarity about the problem to be solved, and before they even think about any technology or AI, they have that clarity, because the goal is not more AI, the goal is better care. So I have many years of experience as nurse first, then as a nurse practitioner. I have worked in multiple settings, and I have observed how care are delivered very close. And the bigger problem of healthcare is not care itself. It is everything surrounding the care. It is the way clinicians, instead of focusing on the patient, are managing system. So that's where came this deep desire to help healthcare system implement this new technology in the way that actually serve the mission of healthcare, caring for people.
I love it. Oh my God, that's so amazing. What got you into this such an upcoming field? Because of course, you being a nurse, then how did you make that transition? And how did you sort of get started with becoming, in a way, that AI consultant? And I love that, by the way, because it is so important. It's not about the rat race of, oh, I want more AI, but it's about, okay, what is the real problem that you want to solve? And then you see, and of course, that goes back to the fundamentals. Like, you got to focus on understanding the problem deeply first. Only then can you come up with solutions, whether AI or if it is a deterministic flow or if it is whatever it may be. It doesn't matter, but it has to be like the problem needs to be understood completely. So, how did you transition into this?
So, what got me so excited is not what AI can do in terms of producing notes or everything it can generate. What got me excited is the people and the ability of the possibility the AI have to actually help people, assist clinician of giving that human care, because healthcare exists to care for people, and clinicians get into healthcare to care for people, not to manage system. So when when AI first hit healthcare, I got so excited because I saw the possibility, if implemented the right way, AI can give something clinicians have been increasingly losing: their attention, their presence with the patient, their ability to think, to really come up with something personal or designed for the patient in front of them, the ability for the patient to feel heard, because the clinician will not be busy managing the system. The system can take care, AI can take care of that administration task when the clinician is actually present with the patient. So let me paint a little story about what got me really, really excited. I am not just a clinician, I am also a mom. And my son have autism. Throughout the year, I have observed, anytime I get to a clinician with him, the clinician that is not rushing, that have the time to actually look at him, be present in the moment, he will be more calm. He will be more willing to kind of participate in his care. So that got me so excited, because no matter the age of the patient, they are going to the clinician because they want that human interaction. They gain more value from it. A lot of people this day can find information on the internet. They have this chatbot they can get information from. But when they go to the clinician, they are looking for that human-to-human interaction. They are looking for a clinician expertise, but also that presence. So I saw this possibility of AI returning that to the clinician, the ability to fulfill their mission, why they got into healthcare to begin with.
That's beautiful. That's beautiful. So your own experience sort of gave you a taste that, hey, really the clinicians need to be focused on being present in the moment and not be on their mobile devices, charting side by side, taking notes, but they need to just be more present. And I think I agree with that. And of course, going back to the fundamental, like understanding the problem and thinking about everything else outside of the care that the clinician has to do and eliminating that. Somehow having technology and automation and AI do all the other tasks, but let the clinician sort of focus on just the patient and that human to human connection. I love that. And for me as well, with my journey, I started to really dig deep into the home health agencies and the operations that they have. What do the clinicians have to do? What is a day in life for them? And I took these sticky notes and started to name every single problem. I would read reviews from clinicians, like, why they quit this job, or they would sometimes leave a Google review, and I would have an AI agent sort of go and scroll the entire web and give me those problems. And I found, like, for every single problem, I had a sticky note, and some of them are still on the wall, the glass wall that I have here in my office. But it was just like so telling to understand deeply some of those problems and so important. And I think that's what helped us in narrowing down some of the problems that we could actually one by one tackle. It's easy to say that, oh, let's boil the ocean and let's have AI do everything, and there's a cloud home health agency in a way. But, that's something that is definitely a recipe for a disaster, because you can't do everything, and definitely you can't do everything all at once. You got to take one manageable piece and see how you can have an impact and iterate on it and try to like come up with a workflow that just really works. So all that to say that you can't automate a broken workflow. So tell me more about this. This is sort of your signature line. Like, why does bolting technology onto a broken process just creates like faster chaos, if you will?
Absolutely, having. We have to start by determining the problem we are trying to solve. And healthcare leaders usually want speed. They want to listen to AI vendor. They have pressure from the boardroom. They are seeing the competitor applying AI, so they just want to jump right in. So when I come in, I tell them to slow down. We need to determine the problem you are trying to solve. And in order to find the problem you are solving, you have to assess your workflow. So I show them the way to assess the workflow. What does that really mean? Like for a leader, it doesn't mean grabbing a clinician, putting in the meeting, and at the end asking them, like, is this AI a good fit? Do you like it? No. It is observing what they are doing, walking in their shoes. Like, leave your office, go right on the floor, like in the ER. Observe what a clinician is doing from the beginning to the end. After they see a patient, observe how they open the EHR, how they document, how they are being interrupted by phone call, how the inboxes message are coming in, how the front desk is coming to ask them questions. So walk into their shoes, not to judge them, but to determine where is the bottleneck, what is adding unnecessary cognition burden. And then you ask them, if I could remove one thing from your day that could make significant impact, what will that be? When they answer that question, record it. Go closer to what they are doing. Ask them, ask their feedback. Only then you know exactly what they need. Sometimes the solution is AI. Sometimes it's not. You find out sometimes it's staffing issue. Sometimes it's policy that need to be revised. Sometimes it's communication. But it's not just AI. You cannot solve a problem that is not clearly defined. I often compare it to my clinical work. Like when the patient comes to you, you don't just jump to prescribe a treatment. You have to take the time to listen to them, make a proper diagnosis. Only then you determine what treatment is best to solve their problem. Otherwise, you will say every patient that comes to me needs surgery, like automatic. You cannot predetermine the result of an assessment. So jumping into AI just look like that. You are predetermining the result of an assessment that wasn't done. That's why I believe the goal is not more AI. The goal is better care.
I love that. I think all of this can be summarized in just one word: empathy. It's so important for building a good solution that actually helps. We've been taught, even from back in the day when I went to UT, we had a capstone course for the entire course, and we spent so much time in market validation, in actually understanding whether this is a real problem or not. And how do you do that? By talking to the user. And I still remember even my own experience. It's easy to make that mistake. And initially, one of our customers was not in like town, and they were in Colorado, and a lot of the interactions were happening over a GoToMeeting, or it was happening over the phone, and we would understand, but I would say it was only 50% because we weren't sitting right there. Everything changed when we got one of our best marquee customers who invited me over with open access to their entire office. Of course, we signed the BAA, and they said, Arvind, go at it. You obviously are here to help us, support us. What information do you need? They gave me a login. I could pull whatever reports. And guess what? I just sat besides the intake team to actually see how they're making the phone calls, what kind of challenges they're getting, what are the challenges that the scheduler are getting. And that's when I realized where there were so many problems. And then I got to at least understanding 70% of that specific sort of workflow. Even then, I had to come up with a proposal. And then as I interacted with the nurses, or anybody for that matter, the question that I would ask was, and what's the hardest part about what you do? What is the hardest thing that you find in your entire day? And that's when I would hear answers. I was like, oh, you know what? Entering all the medications, because in home health, it's a little bit different. You're getting the discharge papers from the hospital, and you have to provide home health service, that skilled assessment. Initially, there's the admissions that takes into consideration your entire head-to-toe assessment and different bodily systems. And that's when you establish sort of the baseline, and you have to enter all the medications. And some of the patients may have 40 different medications. I was like, wow, okay, got it. Well, and then I would ask other clinicians, what's the hardest part about this? And then they would give me maybe sometimes a different answer. And they were like, oh, charting's the hardest thing, I wish it would go away. Well, then how are we going to find out, like the next clinician that goes, or the physical therapist that goes after the skilled nurse, how would they know what is the condition? I mean, then they're all looking at just the discharge papers, but then the assessment that you did and the plan of care that you generated is not really privy to some of the other therapists or even the home health aide. Yes, you can generate a care plan for them as well. But I think those are the kinds of challenges that I started to then understand. So I agree. And I feel like this is a little bit of a productivity paradox. Like there are more tools than ever, and clinicians feel busier than ever. So because as an experiment, we also came up with a tool that would help you do teaching for the patients and the caregivers. So let's say if a patient is having a fall risk or a type 2 diabetes, then we would give them an AI-generated video that they could show to the patient and talk about it and try to understand the disease, signs and symptoms, and the disease process and all of that stuff. And I thought it was super helpful, but the proof was in the pudding. I wanted to see the usage. I wanted to see clinicians would actually use it or not. So I gave all of them that application, and I just observed none of them were using it. And I was like, okay, maybe I need to understand the psychology of that clinician. Obviously, they want to just be there with the patient, and they want to get in there, and they've got another patient that they have to text if they're running late. If the appointment goes from 45 minutes to an hour, then they're having to adjust their schedule. So like getting in their shoes and empathizing is just so important. And so like, why does every new healthcare tool seem to add work instead of removing it? Like there's a tool fatigue and, technology stacking and, this click and tap fatigue in many ways. What are your thoughts on that?
So before deploying a tool, I come back to the same thing. The problem have to be clear enough. And to clarify the problem, you have to get close to the people that are actually using it, that will be using it, and the one that are giving the care to the patient. That is the frontline worker. That's why I take so much pride and I enjoy what I'm doing, because multiple leaders are making that mistake of just jumping on investing on a tool without making sure it is going to solve the problem that their workflow or their healthcare is having. So I help them prevent expensive mistake. Because at the end of the day, the clinician have to trust a tool to use it. The tool had to help the clinician do the work better than before in order for them to leave what they was doing to use that tool. I take an example. There was this time the organization I was working with introduced to us the AI documentation tool. Leadership geniusly think it was going to reduce the documentation time and give some of the time back to clinician to spend with the patient. We were so excited. We were looking forward to it. We have a meeting about it. They explained to us how it was going to improve our work day. Then came the day. I used it, and I remember walking back to the nurse station and thinking, wait a minute, this actually took me longer to do the job than before. As a clinician, I wasn't asking how impressive is this tool. I was asking, can I trust it? Can I trust to use this tool while I'm still delivering patient care? Because instead of using my usual workflow that was straightforward, I have to go on different dashboard, multiple click, and then when the AI generated the note, I have to go through it, make sure what it was saying makes sense, and then that I could trust it before I could validate it. So at the end of the day, it took me longer to do what I was doing before. Eventually, most of us, we returned to the old way of working because that was just something we trusted, that we provide safe care to the patient. That's why I say organization should not start with technology. You should start with identify the bottleneck, exactly what your clinician needs. Only then you can determine if AI is the solution, or is staffing, or is just redesigning the workflow. Because sometimes just designing the workflow gives you more value than investing in the AI tool. AI is just one possible intervention. It shouldn't be predetermined, like everybody have to adopt AI. No. Make sure you have a problem you are trying to solve before solving it. And AI should support clinicians, not compete with them. Because at the end of the day, we should protect what only human can provide. AI is just one possible thing or tool to help us maintain that human-to-human connection. It's not just more AI, it's better care, the end goal.
Absolutely, Genevieve. So let's problem solve a little bit. Let's, because you have experience in home health as well, and that's sort of our focus. So if a home health agency comes to you and says, okay, well, we'll give you all the answers if you have the questions to ask. And the way right now, the current problem, let's say this home health agency X is having, is that, we're not able to receive notes on time so we can bill. We can bill for all of the patients, because if your note is pending, you're a PT or you're a skilled nurse, then we cannot bill for the entire episode for anybody. So one note that is pending would block the billing. And of course, the Medicare, certified healthcare, home health agencies are getting squeezed because of the cuts in Medicare and the reimbursements and, other crackdowns as well. So how would you have them sort of solve that problem. So their problem is simple. It is, hey, nurses are not submitting their notes on time. Some of the nurses have 100 notes pending that are not done from even 2 weeks ago. And again, like some of them, yes, are doing 35 visits per week. Maybe some of them even 40 visits per week.
So in healthcare, there's two type of work. There's a work that require judgment, clinical judgment, and there's a work that only administrative task. So when the problem is clearly defined, now you need to separate what only clinician can do and what can be automated. Things like judgment, clinical judgment, things like delivering a customized patient education depending on what the patient told you, critically thinking, those should be protected. You should not automate those ones. But the other part, like putting notes together, prior authorization, like you were saying, like one of the time I witnessed the magic of AI was when I observed a patient and the clinician from far. The clinician was fully present, listening to the patient. The patient was giving eye contact. The clinician was actually not in the rush, letting the patient express everything and picking up on what is not being said. Why ambient AI was at the background doing the job, taking care of all the administrative part. That was magic. So I tell healthcare organization, when you determine the real bottleneck, the real problem, now divided in two, one is things only human can do. The other one is all administrative. Those are the one AI should jump in and help, because at the end of the day, AI should serve clinician. It shouldn't be the other way around. Like healthcare this day, we go to healthcare facility, the clinician is so focusing on documenting, clicking. Patient is talking, the clinician is like, no, I am listening to you, even though I'm not looking at you, because they are busy with the system. So AI have the potential to take away what is breaking the mission of healthcare. So if organization can slow down, assess the workflow, determine the actual problem, then solving it would be easier. Because at the end of the day, the goal is no more AI. The goal is better care.
Absolutely. And, for our audience as well, sort of taking you back to the problem that we are trying to solve, like for home health, there are pending notes. Some nurses have 100 pending notes. They're not finishing it. So I think somewhere in your answer, very eloquently, you described like maybe an ambient scribe could be a solution where then the clinician still focused on the patient, but then there's a device like this that's always recording. And so is that what you think then is the answer? But I'd like you to think again, because sometimes in certain settings, ambient scribe is great, meaning in a hospital setting where you have a lot of interaction and the way that the doctors or the nurse practitioners interact with the patient is a little bit different than in a home health setting when the clinician is going to somebody's home where it's a lot of observation as well. Are the hallways cluttered? Is there a fall risk? Are there, how's the psychosocial for this patient? I mean, there are so many other things that are observation, and it's not really everything that is spoken right there. So, I mean, how do you then ask more questions to try to come up with, like the problem then in that case, you would agree that is well defined. We know that we need notes And we know that it's not everything that's going to be spoken, it's observation as well.
Yes, that's what I said. The result of our assessment is not predetermined, and each setting is different. What might work in the hospital might not work in the home health. Different setting, different needs. That's why I always say begin with the assessment of your workflow, because you will find out maybe ambient AI is not the solution in the home health. Maybe it's something else. So, but you won't find out that until you go closer to the people delivering the care and asking them real question like, how can I assist you better document on this patient and still be fast and still deliver your note on time? When you ask those kind of questions, then the clinician will give you the answer. Maybe the answer is, don't give me too much patient for one day, reduce my case load so I can have enough time to give you back the documentation you need after I
So
care for
it's a
the
good
patient.
direction. Sorry to interject. But like in home health, nurses get paid per visit. So fewer patients means fewer visits means lighter paycheck. So that may not be the solution. But you're right. Like every setting is different. And like I said, we got on this mission as well to really understand. And it wasn't obvious because we saw 19 other competitors who were doing ambient scribe, some of them with different solutions as well. And everyone has their own unique way of solving the problem. For us, when we asked the clinician, we got inspiration from one of the companies who had somebody in the back office talking to the clinician while the clinician was at the location and asking, okay, well, tell me about what's the problem. So she's articulating. And this person is smart enough and fast enough in documentation, and this person is documenting. And I'm like, wow, we all need that back office support with somebody calling and understanding. So you're just naturally talking and giving a report like you're talking to a colleague. And that's when we came up with our AI agent. We call her Joy, and it is somebody who would call you right after the visit. You could go to our app and press a button and it knows your number. It calls you, and you just talk normally, and you say, okay, well, how are you? And you have so many visits today, and that's great. Do you have a moment? Can you talk about patient care? Are you in a position where you can confidentially discuss this? And the clinician's like, yes, sure. And guess what? That changed everything. We see nurses starting their day with calling in, and from one visit to another, when they're in the drive, they're just dialing the number, and they are just loving it. Because guess what? Joy then remembers you as well. Kind of like how initially ChatGPT came out and then ChatGPT got memory. So we gave Joy a memory as well. So there are certain nurses who really wanted to write good notes, because in home health, every note needs to stand on its own for that visit. And that's why one nurse, had immigrated from Cuba, and she couldn't speak very good English. And we were like, okay, well, Joy speaks in Spanish as well. Go ahead. And then she would just talk, with Joy and just explain everything. And then Joy can ask more questions. It would ask, okay, so what was the skilled care that you provided? What was the medical necessity? When was the last bowel movement? So that people don't forget to mention that, even if you're asking and if you're not documenting right there. So that really changed the game. But then again, I still feel like there's so much more that we have to know and learn and understand, and slowly just be monitoring the behavior and being there with the clinicians. That's why whenever I start the training and onboarding for clinicians, I first make sure that I let them know that, listen, I am on your side, and really, truly, we're never gonna force you to use the tool only if you have pending notes. If you have a dozen pending notes, don't even go to 100, because many clinicians do have that. But if you have a dozen pending notes and then you don't want to try to give a call to joy, then we need to maybe have a conversation and understand what do you not like about it. But otherwise, it's not mandatory. I even worked this last story. I even worked with a really amazing clinician who was doing it as a hobby. She would just do one visit a day and she would spend as much time as needed because the background was in teaching anatomy and all of that. And they were like, listen, I love writing. This is like a story for me. And, she started showing me the notes. She's like, look, when I saw the patient open the door without the walker, I'm like, today your teaching is going to be on safe ambulation. I'm like, wow. And he says, listen, I put it in the notes here, and then I tell the story here. I'm like, oh my God, you take so much pride in doing your work. You do not need to call joy. And then when I mentioned that this is really optional, then the response I got was, but wait a minute, can joy tell me what are the unmet goals and what should be my plan for the next visit on the basis of the description that I gave? I'm like, yes, and I love it. So that's how it's very difficult otherwise to come up with these ideas unless you're there sitting and asking open-ended questions from the clinicians like, all right, no problem. I'm not here to push AI, but tell me what's the hardest thing about the day right now, and why do you have these notes pending? And if you don't have the notes pending, totally understandable. Is there something we can do for you? Because my team, we just get excited about new things and new technology, and we're like, oh my God, look what Fable can do. And, now we've got this new way of doing things. So yes, we are inherently like in technology getting excited about all these things. But when I go and talk to the clinicians, I'm wearing that hat of just listening and asking open-ended questions. But I love that, like how you said that it's not mandatory is a very, very important point. And it's really separating the operational clinician from the actual caregiving like that needs to happen and that connection that needs to happen with the patient. So yeah, I think nowadays there are some concepts that you've explained in some of your writing as well. Maybe you could describe on that angle of like the operational clinician. How do you describe that in some of your writings?
First of all, I love what you guys are building, especially the fact that you guys get closer to the clinician and really define their needs before customizing a solution for them. So healthcare needs more people like you who are really trying to solve the problem. So when it comes to my clinician lens, so picture this, like the patient is talking, right? The clinician is not just listening, but is picking up on everything the patient is not saying, connecting the dot, putting things together, drawing in years of clinical knowledge, training, and experience to come on with a unique plan of care to that patient. From the outside, it might look just like a conversation, but inside the clinician mind, years of clinical judgment, empathy are coming together to serve that one patient. So that type of care cannot be rushed. It needs time, it needs space, it needs cognitive ability to think. That's what healthcare leader should try to protect, that kind of moment. That's what AI
I love
should
that.
give back, yes. Because at the end of the day, it's not just more AI, it is better care that come through protecting the people that are providing the care. Because that's why they get into the healthcare to begin with, to serve the people. That's the calling. So leaders should aim to protect their mission, and everything will follow. Better care, you will have best return on your investment when you give clinician back the ability to actually care for the patient.
Absolutely. No, I think no doubt about that. And thank you for your kind remarks as well. I think that's what we all need to do. Like, if fundamentally, if you just love the clinicians and you're on their side and you're like, this best sort of friend for the clinicians who's trying to understand them, what their day is going to be like, understanding, where they're going and what are some of the challenges. The more you understand that, the more intuitively you can think about, all right, this might solve the problem. This might solve the problem, because the problem is well defined. We need notes to come in the same day, just like in a hospital setting or an ER. So last question here for you. Let's think maybe a decade, from here, like healthcare in, 2035. If we get it right, redesign before automation, prevention over reaction, sustainability for clinicians, what does healthcare actually look like in 10 years? And if you could redesign from scratch, where would you start?
So, the value of AI isn't the number of tasks it can perform. It is the ability to give clinician that presence, return to the clinician the presence they need. If technology gives clinician more time to listen, to think, and to connect, it has created great value. The future of healthcare won't be defined by how much AI we use, but by how much humanity it helps us to preserve. So if you picture a patient talking, clinician listening, fully present, letting the patient finish the full story so they can really get to the root cause of why they are there and customize a plan of care for them. And they are not worried about the administrative tasks because AI is at the background, is taking care of it. The patient will feel hurt. The patient will feel taken care of. And the clinician will feel like they are fulfilling their mission, the why they get into healthcare. That will motivate them to wake up in the morning happier, excited to go to work. And the patient is excited to come and see the clinician because they know they will fully listen to them. That is the kind of future I envision and I am working towards.
Beautiful. Well, thank you so much, and genuinely. And like I said, you're one of the few people who has seen it from many angles, and I think you're bringing those sort of first principles to, honestly, a lot of the Silicon Valley principles as well of iterating on the product and empathizing with the user. I mean, we learned this even back in designing mobile applications, back when we had just started, that you really have to step in the shoes of the users. So I think really, really great work you're doing. From our audience, if someone wants to get in touch with you and would like to, consult with you, how should they get in touch?
Absolutely. The best way to reach me is on LinkedIn. That's where I often publish my thinking about how to implement AI in healthcare and leadership in healthcare. If you want to follow my methodology, you can go on radiantwellnetwork.com. That is where you will get my free guide, Why Most Healthcare Implementation Fail, where I really go deep into where you should start if you are considering AI. So for any healthcare organization thinking on implementing AI, that would be a great place to start.
Fantastic. I love that. So everyone in the audience, you know where to go. We're going to put the links below on YouTube and everywhere else that we post the podcast. And absolutely find Genevieve. She's fantastic, as you heard on this podcast. And I think these are the fundamentals that a lot of times you may already know as well, but you need a partner who can help you sort of think through all of this stuff. So any of the healthcare organizations out there, you know who to contact. And then, of course, if you're in home health and if you have pending notes from your clinicians, and you would like to have your skilled nursing visits, your PT evals, your start of cares, your research, your rocks and discharges and transfers and death at home, all of these different types of OASIS be done just by having a conversation, then you could contact us. And right now, we're only working with agencies in Texas. Very soon, we're going to expand to more places. And we're only working with agencies who have Kinser as their EMR. And if that criteria is met, we'd be happy to work out and even offer you a free pilot for our product. So until then, thank you very much. And Genevieve, looking forward to reading more articles and staying in touch and continuing to have this conversation, because we're living in just some amazing times for healthcare, and there's so much innovation that can happen if only we can understand and focus on one problem at a time. So thank you for everything that you're doing for the industry.
Absolutely, Abby. Thank you so much for having me.
Wonderful. Have a good one.
Bye.